We've had such interest generated, and we appreciate everyone. We've got time for one more question. Okay. Go ahead.
Hi, my name is Zach. I'm Monday, and I want to thank everybody for coming out. This is obviously a topic that we need to discuss further, educate the rest of the public on,
Yes.
other than this room. My question would be to Ms. Tenpenny.
Tenpenny, Dr. Tenpenny.
Tenpenny.
All
Tenpenny,
right,
that's done.
Dr. Tenpenny.
Okay.
I've had my name screwed up before, but never quite that. It's Tenpenny, pretty simple.
It's about the vaccination, not about you. No. Okay, my question would be, how do you measure the full safety of vaccine based on tests done with a time limit before being widely used to vaccinate? Where in the testing process are the long-term problems addressed?
Do you need that question repeated?
Yeah,
Would you repeat that question?
A little bit slower.
I needed it.
Okay. How do you measure the full safety of a vaccine based on tests done that have a time limit before they're going to be spread for vaccination, obviously? And where in that testing process do the long-term effects of the vaccines come into play?
The real studies that, it's still a pretty unclear question, but I'll do my best, okay? I think that the real studies that come from vaccines are after licensing, they're post-licensure, that's the one thing. Because there's small studies that are done, it's small, meaning anywhere from a couple hundred to maybe several thousand. But when you finally release that vaccine out into the general community, the same applies for medications that are released. And now millions of people across the country and across the world are now taking the vaccine. That's when you start to really do the testing to see what the side effects are going to be, is post-marketing surveillance, and that's phase 4 clinical trials. The other thing is that I think it's really important to address here before we close is one of the things about safety issues is that we really do need to do the studies of looking at vaccinated versus unvaccinated populations. There are tens of thousands of children that are out there now that have been homeschooled. There's a large practice in Chicago, the populations of kids in the Amish population, chiropractic children. There are tens of thousands of kids out there that are unvaccinated. And so for the CDC to say we can't do that study because it would be unethical to look at that study, the study's already been ready-made. And if we actually look at the fact that unvaccinated kids aren't as healthy than the vaccinated kids, then maybe we need to look at that issue a little differently. But if we do simply a survey study and say of the unvaccinated kids, how many days of school are missed, how many drugs are they on, what kind of diagnosis do they have, what kinds of grades do they get in school, I'm sure I'm not a study designer, but I think that we could actually seriously look at the unvaccinated population and look at their health versus the health of the vaccinated population, and that's where we're really going to find out where the research lies.
Okay, just a little add. I just have one more. Say we do the vaccine and a problem occurs 20 years later. What kind of testing do we do now that is going to reveal that problem later?
We can't. There's none.
Okay, so that's...
Dr. Betts, do you have a follow-up rebuttal to that question?
Yeah, I guess that there'd be 2 or 3 points. First of all, I agree that some of these initial vaccination trials are they're small samples relative to the millions of people that may receive the vaccine. And I pointed out the initial rotavirus vaccine that came out turned out to have a problem called interception, where the bowel kind of sucks in on itself. And as more people got the rotavirus vaccine, it became it was obvious that this was a problem. The vaccine was actually pulled from the market. Let's see. The other, I guess, issue I was going to say is that the H1N1 vaccine is being manufactured by the exact same manufacturers that make the seasonal flu H1N1 vaccine, using the same production lines and the same technique. So I think this is a fairly effective and safe vaccine. It's actually 1 antigenic component versus 3 that's in the seasonal flu vaccine. So I think these are, it's proven to be a safe vaccine, and I think it will in the future.
Thank you, Dr. Betts. Now we will, that's the end of questions. Now we will turn to concluding remarks. In this last phase of the debate, each panelist will have 5 minutes to sum up what they would like to let everyone know. I will have Ms. Richardson go first, followed by Dr. Betts, and then Dr. Tenpenny. Ms. Richardson.
Just like you don't have to be an automobile manufacturer to be an educated consumer when choosing to purchase a family car, you don't have to be a vaccine developer or even a doctor to look at a vaccine and make an educated, informed decision, whether its safety, efficacy, necessity, or even cost falls within your personal standards. This is the United States of America. You should be free to make that decision without penalty of law. You don't have to be a master's in public health to spot poor scientific methodology when looking at research to support the universal use of a vaccine. Common sense will tell you if the study period was too short of a duration or not enough people were included, if there were inadequate controls, or if safety was even adequately considered. Just like you can research other products or services that you use, you should be able to research vaccines and make your own informed, educated decisions for your own family rather than blindly following requirements set up by people who are from the government and here to help. Do you know that just about every single vaccine has disclaimers on the manufacturer's package insert that read something similar to, "This vaccine has not been tested or evaluated for their carcinogenic potential, mutagenic potential, or for impairment of fertility or reproductive capacity"? Seriously, the vaccine manufacturers and government have refused to study and publish answers to the questions of whether vaccines can cause cancer, contaminate your DNA, or prevent your ability to have bear children. Why do you think they're avoiding these studies? Why do the tobacco companies deny having studies linking cigarette smoking to the development of cancer? I don't know. What about the swine flu vaccine and everyone in this audience? Can it be legally required right now by law in Texas? There is a mechanism where it could be. So we're trusting Dr. Betts to say, no, they're not planning on doing it right now. But in the Health and Safety Code, there is a provision where the health commissioner could create a unilateral rule, a new rule, requiring a vaccine, or some health authority could do the same in order you to be vaccinated. Both of these actions require lawmaking, execution, and judicial interpretation by, again, an unelected, unaccountable bureaucrat. The separation of powers devised by the framers of the Constitution was designed to do one primary thing: to prevent the majority from ruling with an iron fist, which is exactly what vaccine mandates and a vaccine mandate for swine flu would do. These orders for mandates in emergency situations in the state of Texas don't allow for any exemptions. You know, what about if you were going to suffer a bad reaction? Is it possible? Well, let's just look at the FDA having a long history of approving unsafe drugs. Vioxx, Bextra, Zelnorm, Baycol, Siler, and Paladin are just a few amongst many to trigger your memory. There are many outstanding questions about the safety and efficacy of the swine flu vaccine. It is so new. We don't even know if it'll work. Now, vaccines don't last from year to year for flu vaccines. So what about next year, and the year after that, and the year after that? What about you young people in this audience, you're between 18 and 22? Are you going to take this shot every year until you're 80, 90? I mean, how many shots are you going to get? You have to think about these kinds of things. Mandating this would be a big mistake. I just want to point out that when Dr. Betts said if asked to volunteer to take a vaccine, only 40 to 50% would get it. Hello, maybe some people don't want it. But, you know, that's not even true in all cases. Actually, in the state of California, the legislature passed a Prevnar or pneumococcal vaccine mandate. Got all the way through the legislature. Guess what? Governor Schwarzenegger vetoed it. You know why? Because voluntarily, over 80% of the parents chose to get that vaccine based on their communications with their doctor, and he felt that there was no reason to have to use the force of law, since many people were already choosing to get the vaccine. It's not going to stop here. Today there are vaccines being developed for HIV, tobacco addiction, obesity, chlamydia, heroin addiction, and cocaine addiction, just to name a few. Will we wake up one day to find our babies and children viewed as potential fat-smoking, promiscuous drug addicts who will be mandated to be vaccinated with more expensive and exclusive vaccines? Where do we draw the line over who decides? Something has got to change, and that thing is vaccines should not be mandated. Thank you for allowing me to be here. I've enjoyed it.
Dr. Betts, your closing